Welcome. How do I express and store breast milk? There are several reasons that a breastfeeding mum might choose to introduce a bottle to her baby. For some, it's because they like the freedom of leaving a bottle of expressed milk while they pop out, while still others may be headed back to the workplace. Whatever their reason for wanting to use a bottle of expressed milk, it is important to do so safely. Milk removal is the most important factor in milk production once your body is in that supply-demand phase of breastfeeding. So we want to ensure that the demand is appropriate. This means expressing milk to keep up with baby's demands while you're not with them. But it also means not over-expressing milk and stocking your freezer unnecessarily, as this can lead to an uncomfortable oversupply. Most women find that an electric pump is the most effective tool for expressing milk, but there are some who get a better yield with manual or even hand expressing. So experiment a little and then stick with whatever works best for you. When you do express milk, either with a pump or with your hands, it can take a minute or two to cause a release of milk. Then there will be some sprays. After this minute or two, these sprays subside. That was a letdown. If you continue pumping, you'll see fresh sprays arriving shortly. A pumping session will likely to have several letdowns. If you are double pumping, just keep the pump in place for the full session. If you're using one-sided pumping, you'll get the best yield if each time you see those sprays stopping, you switch breasts. Just keep going backwards and forwards between sides until one of these things happens. You no longer get sprays or drips from either side, or you've got as much milk as you intended to pump, or you've been pumping for 15 or 20 minutes. Remember, 8 short pumping sessions are far more effective than 4 longer sessions. If you only have 5 minutes spare, then it's fine to do a quickie pump session. How much milk does your baby need? The good answer is probably less than you think. Babies need increasing volumes of milk as they grow, until they reach maximum milk needs, which happens at around 6 or 8 weeks. This volume then stays constant until milk volumes reduce due to the introduction of solids. Make sure you're using a baby-led bottle feeding method to help prevent overfeeding. Check out episode 25 for baby-led bottle feeding. If your baby is younger than 6 to 8 weeks, a good rule of thumb is that they need 150 ml of milk per kilo of body weight per 24 hours. Breaking that down, if your baby weighs 4 kilos, they would need 600 ml of milk every 24 hours. If they're having 8 feeds a day, we would then expect them to be drinking about 75 ml for each feed. These volumes can vary anything up to 20% either way. Sometimes we have a snack, sometimes we want a feast. If your baby's aged between 8 weeks and 6 months, at this age, babies take around about 750 ml to a litre of milk every 24 hours. Again, assuming 8 feeds a day, which would be typical of a breastfed baby, individual feed volumes are therefore somewhere around 95 to 125 ml. Of course, if they're having more feeds per day, feed volume is generally lower, and if they're having fewer feeds a day, it will be higher. Once solids have been established after 6 months, the total milk volume taken in does tend to go down. However, portion size would be similar to those you've established in the first 6 months, with the change being in the number of portions taken per day. Be guided in volume by how much your baby has typically taken until now. If they've not had express milk until this point, give them around about 120 ml and go from there. Often you're not using your expressed milk straight away, but need to store it until it's needed. Check out this episode's matching article below for a more detailed breakdown. But in general, expressed milk will last 3 to 4 hours in a warm room, up to a week in the fridge, and up to 6 months in a freezer. If you have a premature or seriously unwell baby, speak to your baby's doctor regarding stricter storage guidelines. If you know in advance that you will need to thaw frozen milk, you can thaw it slowly in the fridge. This usually takes around about 12 hours. Once it's defrosted, keep in the fridge and use within 24 hours. Don't refreeze that previously frozen milk. To warm milk from a fridge, put the bottle or storage bag of milk into a cup of warm but not boiling water. Alternatively, use a bottle warming device. Never ever heat milk in the microwave. When you warm milk, the fat layer in stored milk separates and rises to the top. Once it's warmed, gently swirl the milk around and it reintegrates to the feed. Unfinished bottles can be kept and offered again to the baby within the next couple of hours. Spoiled milk will smell bad and taste sour. So, to recap, when introducing a bottle of express milk, it's important to express enough for your baby, but don't over-express and create an oversupply. Experiment with which kind of pump works best for you. Keep pumping until either there's no more sprays of milk, or you've got the amount of milk you want, or frankly you've been going for 20 or 15 minutes and you've had enough. The amount of milk your baby needs varies by age and weight, but it is probably less than you think. Express milk can be stored for up to 3 to 4 hours in a warm room, a week in the fridge and 6 months in the freezer. Thaw frozen milk slowly in the fridge and never refreeze. Warm milk by placing it in a cup of warm water or using a bottle warming device. Gently swirl that bottle to reintegrate the fat layer. Unfinished bottles can be fed to the baby for the next couple of hours, and spoiled milk should be discarded.